Edit your relationships. There are people, let this be the last time they will be in your life. Yes, sir. They deserve to receive a goodbye based on the antecedents of their making you an evil person. They deserve. This is not about being good or bad. This is about your determination to go forward.
My name is Asitonka Agri Abba, and the channel is called Asi Darling because I'm such a darling. Hi guys, and welcome back to my YouTube channel, Trevor Asi Darling. Thank you guys so much for clicking once again. If you're new to this channel, please consider subscribing, and to all my OGs, you know what to do. Comment down below, let me know, gang. All right, on today's video we have a very serious and important topic. It was announced this week that 4 UK health workers were jailed for abusing an elderly patient. Now, one of the jobs that people find themselves doing, especially this period where there's lots of migration and all, I always tell people that this migration period is not something new. During the times of our parents, I'm sure there was a period where there was a boom, there was a shift. So most of us grew up hearing our parents say, "Oh, there was a time I wanted to come to the US or the UK. All my friends were moving and all of that." And then after a while, it settles. And then after a while, there's a shift. So this period was about the shift, everybody moving into different areas. And one of the jobs that was most popular is healthcare workers, caregivers, private nurses, and all of that. So it seemed like nursing in itself had a major market. People were cashing out. Some people were rushing to study nursing because of how much nurses were paid. People were actually going back to school to study nursing. Now, one of the things I need to point out is, before we get into the story, one of the things I need to point out, because even in Canada, we get people that say, "Oh, they want to come and study nursing." Please, minus the profit part, I hope you have a passion for it. I get that there's nothing you should do that doesn't have profit, and I get, but have a passion for it. As somebody that has been ill, that has done some surgeries, I really pray like you have a passion for it. You're not just doing it because you can get burnt out, you can get stressed, but if you have a passion for it, you will always have that human side of you. Do you understand? So that is one thing I want to keep. I want to beg you, please have passion for it, especially when it comes to elderly care. Most people are going to be caring for elderly when they did not even see their grandparents to care for. Do you understand? Like maybe by the time you were born, your grandparents had died. You've never stayed around old people before. And then you move to these countries and you have to be a caregiver. You have to start tending to elderly people. Maybe you really do not know your way around. Please, if you don't have a passion for it, find another work. Find another. Care pays, oh, hey, they hammer, oh. Me, I know that I cannot do it. It's not about being a bigger person. I don't have that kind of patience. Man, know thyself. Socrates say, man, know thyself. I know myself. I cannot do it. But if you know you can do it, please have a passion for it. Because there is a thin line with this abuse thing. Let's read this case now. It says 4 healthcare workers have been jailed after they were caught on camera physically and emotionally abusing an elderly patient, reports the BBC on Thursday. While Ame Tonkara and Moruntaro Adefila were found guilty of ill treatment, willful neglect, and sentenced on December 8th to 4 months in prison. Danny Ohen and Bridget Ideyan were also found guilty of the same offense and sentenced to 6 months and 4 months respectively on November 14th. The police revealed that the workers were caught on camera manhandling an 89-year-old woman who had vascular dementia and could not speak. That is wickedness. In February 2020, the woman's family had secretly installed a camera and recorded footage over 4 days after noticing bruising on her arm. It showed the woman being rough-handled, hit with a pillow, treated with lack of dignity and respect. The woman, meanwhile, sadly passed away in October, with a police official saying she should not have spent any of her remaining years suffering such ill treatment. Guys, let me know your thoughts in the comment section. That is so sad. That is so sad. Oh, that is so sad. One of the things I've learned in this moving to Canada, especially in the place I work, I've come across elderly people. My first experience with elderly people like people that are very old was when I did my youth service and I served in Akwa Ibom. And in my church in Akwa Ibom, there's literally like grandparents fellowship or something. So you see old people. I got to know how to interact with them because I really didn't grow up with my grandparents. I think only my grandmother is alive from my father's side. All my other grandparents are late. So I really do not have that experience when it comes to grandparents. 89, having vascular dementia and having to manhandle the person. She's not even insulting you. She's not, because we have cases where people say, oh, the person is being rude, the person is being racist, the person is being, violent and saying things. Because if caregivers should narrate their story, they have been through a lot. But still, when you pick up a job like this, it comes with the territory. It comes with the job. Different things like this will happen. Please have human sympathy. Have human sympathy, because if there are 4 people that have been arrested, it then means the family had enough to actually maybe solicit the services of more than one person. Maybe they were coming in twos. And then what kind of evil is it that 4 of you had agreed to do the same treatment to such an old woman? And why? Why? Guys, let me know your thoughts in the comment section. Please do not study courses you don't have passion for, simply because you just say, money dey inside. Don't do that. I'll give you an instance. Initially, in Nigeria, our mindset is when we grow, when you start making money, you retire your parents. After moving to Canada, I found out that is very wrong. We are making these people get old on time, because here, I have supervisors that are 65 that are still working. I know people, like I've met a dishwasher that is 70. Dishwasher, he's 70. Do you want your grandparents to still be hustling at that time? Hustle, quote unquote. Maybe no. But the truth is that feeling of having something they are waking up to do keeps them more alive. Keeps them more alive. I know that people will say, people often say, oh, abroad is a leveler and there's no rich or there's no talk that in outside though. Maybe na the area where they dey. It's not leveler of anything, no. Hey, I have seen money having people. When they say inside that you're Evian, another Evian dey inside. I have seen those Evian people. Even the inner Evian. This country is sweet when you are old and you have plenty money. When they get to a certain age, I remember overhearing a conversation with older people like this age. Basically, kids have gone, and this kind of place, when children marry and go, you have to maybe arrange a meeting, kind of like a lunch or a dinner, to have your children back together. And then they have big houses, maybe like this, my house. What do you want to do with the house? All your kids have married and everybody has gone out. What they do is now, this is recent too, they will check themselves into a retirement home. Those retirement homes are expensive. Some are luxurious. There's one that I took the paper because I was so amazed that their facilities, spa, this one. I think that one goes for like 5,000 or 6,000 or so a month. A month. Hey, a month. But if you look at it, somebody that is 80, she can pay to stay there like as long as she wants, arrange for the balance of the money to be sent, willed into her children. Like, these women were talking, they were so much alive, but they were talking about will, preparing for, like, the concept of life is so fragile. It's so fragile. I know that we are going off. I want you to understand that when you see 89, somebody is manhandling an 89-year-old person, vascular, understand that it's a blessing for anybody to reach this age. All of us, we should be praying to reach this age as like with our right mind, because dementia is a painful disease. And then when you see that even the family members, the children are seeing that their mom can't recognize them. Even when she can recognize you, she can't say, because vascular dementia. Guys, let me know your thoughts. I feel so upset. I have seen, there's a lady that I've worked with. I've seen one older lady that came to the club and she was like 93. Have money in this country. Hey, have money for your old age. Save money for your old age. Save money for your old age. Her pearls, like small pearls. See her cute bag. See her lipstick. See her. 93. They whine. They were just casually eating people's rent. Casually, just they chop, like waiting they chop na person rent, just like dinner, just brunch. Have money. Now, at that age, somebody is so comfortable to the point where, no. It's well, guys. Let me know your thoughts. One of the worst things that can happen is dementia. I have a neighbor we used to know. Just thinking about it really hurts me. The guy got old. He used to live in our compound back then when I was growing up. And he got very old. And I think he had dementia or something. Apparently, they took him to church because they thought it was a church thing. And he said he wanted to ease himself. And he went and they kept waiting and waiting. They didn't see him. Maybe he came out and got confused about where he was going to, started heading in another direction. And that was how he got missing till date. Nobody really knows what happened to him. Nobody really knows where to find him. Nobody really knows anything. And that is bad. Like, there's no closure for the family. Their dad just got missing. And even if he has died, they don't know where his body is. And then to have this lady spend the later parts of her years, even to when she died, in the hands of this kind of wicked people. You can see that this thing happened around maybe 2020. So it has been in the court system, and they have been trying to, get to this ruling. But I get the pain, because if it's my grandma, if it's my mom, I'm going to be very these 4 months for no do me. I'm telling you the gospel truth. Let's not lie. These 4 months will not have been enough. I don't even know if I would have waited for government to take a deal. Guys, let me know your thoughts in the comment section. So for those of us that are coming into different countries, whether it's UK, Australia, or wherever you're going to, before you go and choose support work, the work is hard. I know that you are looking for money. If you cannot do it, don't do it. This has to do with fragile old people. Some of them are rude here. Some of them are this. Some of them are whatever they are. It's better you don't take the work pata. Because me, I don't want a situation where I go and nod somebody's grandmother. Say the verse, say she call me one thing or the other. Hey? What do you want to say? RIP, mama. Because of anger. I beg. Before you go and give up a cut to somebody's grandfather. If you know that you have hot temper, avoid this work. Just do other warehouse for when only you and Katon go dey quarrel. Do other simple things. Find simple things. Drive Uber, Even the Uber self, if you know you have better hot temper, do Uber Eats. Where you know go dey see people, you go dey carry food, they go drop for them. Like, I feel like when you come to a new country, as much as you want to hustle, know yourself. Because let your village people not set trap with all these things for you. Guys, let me know your thoughts. So those of you that are studying emergency nursing, hope say you like nursing rich, or it's not that you just want, I heard nursing is hot, so let me go and study nursing. Hope you really like nursing. Hope you really like it. Some of you are forcing your children to go and study nursing because you heard that. Hope the child really likes it. Hope the child, because there are people that are struggling, even when I'm not saying that the child is not brilliant. There are people that are struggling. They don't like it. Nursing will suck your blood. If the child doesn't like it, I prefer that you ask very well so that nobody's using exhaustion or whatever to harm another person. Imagine me, like I always think back, I say, whenever you're on the operating table, just be praying for grace, because doctors could have made any kind of mistake. The number of times I was on that operating table, one nurse could have forgotten whole cup inside my stomach or something. Like, I've thought of all weird ass things. I've thought of different things, but thankfully, even though I had these surgeries all in Nigeria, so our medical system is still, I'm proud of our medical. It's not perfect, but the doctors I use, the doctors I've been exposed to, they helped very well. So unless you're that level, you have that level of passion for this work, anything that has to do with medical line, that has to do with something that can possibly harm or heal somebody, think twice and be sure of it, so that we know. Most times when we come to hospital, you can even misdiagnose and the person will go and die. Like, it is so little, like little things can alter somebody's life. So it is important for us, please. Guys, let me know your thoughts in the comment section. I know of a case where a doctor has been charged for wrongly diagnosing hundreds of patients, told them they have cancer because the chemo people used to give him rebate or something, started heavy chemotherapy treatments on them that led to some even dying because he wanted that rebate money. But guys, let me know your thoughts in the comment section below. This is really unfortunate news. I hope that this serves as a reminder to everybody in the healthcare sector. Houses you're going to, be very careful, be very, very careful, document properly. Cameras are set up everywhere. Make sure that you control your temper, control your anger. Don't go there and sleep off because somebody has done a shift and went to sleep. If you sleep, you most likely be sacked because anything can happen to the patient when you decide to go and nod off, okay? Thank you guys so much for watching. Let me know your thoughts in the comment section below. If you have heard any of these kind of weird caregiver stories, whether from the line of the recipient or the patient or the line of the caregiver, let us know your thoughts. Share it in the comment section, and if you see any comment that resonates with you, please make sure to like it so it comes up in the comments and every other person can enjoy it. Okay, thank you so much for watching. I remain your girl Acid Darling. Please check out my other videos. I'll see you in my next one. Bye guys.